Hello, Dr. Tom Lewis with RealHealth Innovations. I'm here to discuss population health management. This video is particularly germane for companies who self-fund their health insurance and the network of businesses that provide services to those companies. RealHealth is a health creation company. We focus on chronic disease management with a particular focus on prevention. Chronic diseases soak up 75% of healthcare spend. Yet most in medicine only react to these conditions and then treat these diseases at the symptom level rather than at the cause level. Chronic diseases and treatments for life contribute greatly to the exorbitant healthcare costs in the U.S. that eat up to 50% of corporate profits on average. RealHealth Innovations has a solution for any organization that self-funds employee-independent healthcare. Our program that I'm about to describe works in environments with 35 employees or more with no upper limit. We've developed a highly scalable program. In the current healthcare system, people are viewed as either healthy or sick. RealHealth recognizes that it's not that cut and dry. In fact, healthcare is actually a continuum. That's why we've defined 4 categories of health, which I'll go over right now. Category 1, prevention care. This is for those of us who are truly healthy. Our goal is to keep you disease-free for life. About 70% of the population is truly healthy and disease-free. This group costs no more than 10% of a total healthcare spend of a group, and individually these people cost less than about $1,000 a year. The RealHealth program for this group is prevention-oriented, but more importantly, it's knowledge-oriented. We help the people in this group understand the basics of health and how to stay healthy by providing content generated by RealHealth and top experts from around the world. However, the group of slightly ill people that we call our prognosis care group comes from this prevention care group. Therefore, this prevention care group cannot be ignored. So category 2 is our prognosis care folks. This is for people who feel well, but when we test them, we find that they are actually at a high risk of becoming sick and soon. About 20% of a population falls into this category, and they cost about 20% of a total healthcare spend. These people generally cost less than $5,000 per year, and we call these people apparently well because they feel well normally, but their physiology tells us a very different story. We use a combination of our RealHealth living profile and our biometric panels that we call Your Chronic Disease Temperature to identify those who are at risk of serious chronic disease. With these 2 tools, we're able to quickly and inexpensively risk stratify an entire population. Often we're able to return these people in the prognosis care group to good health just through coaching. However, a percentage from this group will require more detailed diagnoses and treatments, sometimes drug-based, but not always, to restore them to sustainably good health. The prevention care program then becomes an important component for this prognosis care group. Proper knowledge keeps a once sick person healthy. Category 3, correction care. These folks are diagnosed as being ill and may be on drugs, but many are easily returned to health with or without drug interventions. This group constitutes about 8% of a population and costs about 30% of a total group's healthcare spend. These people cost the healthcare system between $5,000 and $50,000 each year. This correction care group are their pre-diabetics, non-insulin dependent diabetics, people on cholesterol-lowering meds, people with high blood pressure, overweight and obese people, and people with nagging chronic conditions like fatigue, chronic pain, or mood disorders. RealHealth takes this correction care group through the prognosis care diagnostic program so we can understand their risks by way of our RealHealth living profile again, and to understand how really sick they are, and through that we're using our patented biometric panel, our chronic disease temperature again. Next, these people will take one of 2 paths. One group may simply go through a remediation program with coaches or nurses with minimal interaction with a RealHealth doctor. The other group is subject to a deeper and broader diagnostic testing. Once we determine true root causes, a customized disease management program is developed. And as a matter of fact, it becomes very obvious once we have the proper diagnosis. The goal is for all these people is to get them into the prevention care program within 2 years. Category 4, our crucial care program, is for people who are quite ill and require significant attention from a real health doctor. They are sick with many afflictions, all chronic in nature, from pain to diabetes, cancer, heart diseases. Many of them have more than one condition. Fortunately, this group is just 2% of the population, but on the downside, they cost about 40% of your total healthcare spend. And each person in this program averages around $100,000 or more annually, and their spend tends to increase a lot year over year. The crucial care people go through the same set of tests, living profile, chronic disease temperature, that most of our patients go through, but next they become subject to a much deeper and broader diagnostic program. This is the real strength of our program, cause diagnostics. Once we determine true root causes, the disease management program falls into place. Diagnosis drives everything. These patients work closely with a real health doctor, and it makes a lot of sense to put energy into improving the health of these people because they are few in numbers, but they cost our system so much. Real Health is quickly able to determine who is a good crucial care candidate. We look at both their willingness to change and the seriousness and complications of their conditions. For example, to make a change in the health of a crucial care patient, they may need to be slowly removed from drugs that just treat symptoms. This can be a very difficult process, especially with, for example, addictive drugs. As part of the crucial care program, Real Health creates a detailed medical dossier on the individual, then meets with the patient, the existing medical provider team, and determines the right plan for each patient and gets everyone working in alignment. In summary, Real Health quickly and efficiently risk stratifies and creates a risk profile for a population and determines the health risks for each individual. We place each individual into health baskets so we can properly and efficiently allocate the right resources for everyone. We then create paths to improve the health of everyone. We have a plan for your organization to help you create health, thus lower your healthcare spend. Our plan has 2 components. Component 1, our plan ensures that your insured people stay in a low-cost group or don't slide into a high-cost group. Component 2, even more importantly, our plan removes populations from the high-cost group and puts them back into a low-cost group. The Real Health goal is to reduce your healthcare spend by at least 5% year over year. In 5 years on the Real Health program, your healthcare costs could be only 75% of what they are today. Compare this to a number of a potential 60% increase, which is what could happen to your spend in 5 years if you experience a 10% increase in cost year over year. Thus, the real cost savings of our program over 5 years is at least 50%. Let's work together to achieve this goal and create a healthier, happier, and more productive workforce.